Fox 4 is working for you with FOX4 Health.
Your medical records are probably on paper, and papers can get lost or they may be locked up in your doctor's office when you go to the hospital for care. Marilyn McCain shows us how some patients' records are now available when and where they're needed.
Tammy Howard is an expectant mom who knows you can't expect that your medical records will be here at the hospital when you arrive. Tammy knows because she's already had 5 babies.
So if they asked me a question if I had that done and if I wasn't for sure, they wouldn't have it and I have to wait for them to get my records.
This is how hospitals have always kept the records, on paper that's brought over from the doctor's office 2 to 3 weeks before a woman's due date. But what if a woman goes into preterm labor or has other problems that bring her to the hospital early? The records aren't here.
That requires sometimes that additional lab tests have to be drawn, or there's some delay in evaluation and treatment.
Dr. John Yaste says St. Luke's Hospital found that current records for nearly a third of its pregnant patients were not available when needed. A problem not just here, but at hospitals everywhere.
So I thought, well, there had to be a better way.
Dr. Don Miller of Shawnee didn't just think about it, he developed a better way.
And it's secure, and it's complete, and it's legible.
Dr. Miller's system, called eNATAL, is replacing paper records at St. Luke's Women's Healthcare Clinic.
We'll plan, though, on making an appointment for next week, okay?
All the exam rooms have computers. The patient information the doctor or nurse records here can be called up here in labor and delivery anytime.
This time at least they could pull it up and they'll know what I've had done.
Which should mean fewer hassles, better care for moms and babies. Marilyn McCain, Fox 4 Health at 9 p.m.
The St. Luke's Women's Clinic and the Cabot Westside Clinic are the first to have the eNATAL system. The hospital hopes to expand it to other doctors' offices.